Mucosal melanoma is a very rare type of melanoma. It involves and comes from mucosal areas of the body, so it's not caused by ultraviolet light, but rather develops for unclear reasons. And historically, a mucosal melanoma has a much poorer response rate and survival to various treatments that have been used in the past. There has been a revolution in melanoma treatment where we have new agents, immunotherapies that are effective and are giving patients long-term benefit. So the question we had is whether mucosal melanoma was responding at all or as well as other types of melanoma. The study that's presented at this conference is a compilation of data from several different pembrolizumab studies where we collected all of the data from patients with a diagnosis of mucosal melanoma and were able to show that they are benefiting from pembrolizumab therapy. For anti-PD-1 or pembrolizumab therapy, with patients with melanoma have responses in the 35 to 40% range. And we did see that patients with mucosal melanomas have a slightly lower response rate, but it's still a significant and clinically meaningful response rate. The anti-PD-1 drugs are remarkable in that while you can induce anti-tumor effects, the vast majority of patients have very few side effects. The most common side effect is fatigue. Some patients will have a little bit of rash. There are some problems with endocrine, like hypothyroidism. But in general, the drugs are very well tolerated for the vast majority of patients. While the results are encouraging in that you can induce an immune response that is meaningful for patients with these drugs, we do need to improve this response. So therefore, there are many groups that are looking at combinations of immune therapy to try to induce higher responses, and then also to figure out ways to engineer an anti-tumor response in patients who have no response to these therapies at all.